Hi, this is Dr. Brian Palumbo, and today I'm going to be talking about total knee replacements. A total knee replacement is a surgery that is designed to treat severe knee arthritis. So knee arthritis is when the cartilage, the smooth, what we call hyaline cartilage that caps the bones in your knee joint, is when it degrades and erodes over time. There are several forms of arthritis, but the most common is osteoarthritis, which is effectively a combination of environmental, meaning time and wear, and frankly, extra weight has a tendency to erode that cartilage. And there are also genetic and environmental aspects of it as well. However, that's the most common arthritis that we see. The other type of arthritis that we see less commonly is rheumatoid or systemic inflammatory arthropathies. And that usually is an arthritis related to the immune system when the immune system is attacking the patient's own cartilage. The other arthritis type that we sometimes see is post-traumatic. And that could be post-traumatic from an ACL tear, and that has an impact on the articular cartilage over time. As well as fractures and things of that nature. When the cartilage or the joint undergoes a significant trauma that leads to deterioration of the cartilage and then finally arthritis. So those are the types of arthritis that we're treating. And with a total knee replacement, we're basically capping the joint. So we're shaving off a little bit of cartilage and bone. We typically use a saw. And we remove just enough to get the implants onto the bone. The surgery generally takes a little less than an hour. It's done as an outpatient or inpatient, really depending on the health of the patient. If the patient has any type of cardiac or pulmonary issues, sometimes we'll keep that patient in the hospital for closer observation. But if the patient is relatively healthy, then usually we're going to send that patient home the same day. Again, the surgery takes a little less than an hour. Within an hour or two after the surgery, you're going to be up moving. So for the first week or two after the operation, that's when the worst of the pain is going to occur. Generally, because of our blocks, I do an intra-articular block with two medications. One medication is a long-acting anesthetic, which generally lasts for about 2 days, and then there's a short-acting anesthetic. Those blocks tend to last about 2 days in general, and then you're going to have that initial rebound pain, which can be quite severe. It's important to understand this, though. If during the time that you are under the effects of the block, if you're very active, if you're on your feet, walking around, doing things around the house, when that block finally wears off, your pain is going to be significantly worse. If you treat your knee like it hurts, usually I tell folks to pretend like your knee hurts. So lots of ice, lots of elevation. When the block finally wears off, you're not going to be in as severe of pain as you would if you're being very active. So that's the first couple of days. During those first couple of days, it's incredibly important that you're stretching your knee frequently. Usually we're going to tell you that every 2 hours or so, you want to spend about 10 minutes stretching your knee. Generally about 5 minutes trying to get that leg and knee straight. And then you're going to be spending about 5 minutes bending that knee back as far as you can. That's incredibly important to ensure that you have great range of motion, especially the first 2 weeks. But if you're not stretching the knee and the knee hurts and you don't want to bend it, what's going to happen is that scar is going to start building up in the knee, and it's going to be harder to stretch your knee, and that pain is actually going to get worse over time, making it harder and harder to bend and move your knee. We call that ankylosis or stiffness, and it's incredibly important to avoid that because it can be quite debilitating. So after the first week or two, then the pain starts to decline rather significantly as long as you're maintaining and improving your range of motion. If your range of motion is not improving, you're going to have a longer and harder recovery. You're going to have a home health aide and therapist that's going to come out to the house generally about 2 to 3 times a week for the first 3 weeks. After that 3 weeks, we're going to ask that you go to an outpatient therapy facility. It could either be with us, which is our preference. We have several offices around town. If you can attend one of our physical therapy offices, that would be ideal. If you can't, we totally understand. A lot of times, one of our offices may not be in a general vicinity of where you live. At 6 weeks, I usually tell folks you're going to be about 80% recovered from the intensity of the pain and swelling and that sort of thing. At 3 months, you're usually going to be about 90% better, as long as you have good range of motion, which is really an important point. And then up into a year, you're going to have pain and discomfort, which is continuing to decrease over time. That last 10% of improvement is going to depend very heavily on whether you're continuing to do strengthening and range of motion exercises. One of the more common things that we see with our patients is that after the first couple of months, they may lose some motion, or if they don't regain their strength, you'll have some aches and pains that can be quite considerable over time. If you continue to strengthen your leg and do exercises that will enhance your quadriceps strength specifically, you'll find that that knee will feel more natural and will be less painful over time. That is a pretty general recap of the total knee arthroplasty experience. Of course, we welcome any questions or concerns you have, and it's important to ask those questions to either Erica or Sydney or myself prior to your surgery. Thank you. Have a great day.